Hello, my name is Christopher Duran and I want to discuss with you the benefits of using the non-steroidal anti-inflammatory drugs over a long period of time. Now, this relates to a study that's come out recently that suggests or that proves that using these medications long term has been associated with no increased side effects than if we use them for a week or a few days. That's a good finding because we do have to rely on long-term use for a lot of these dogs, so it's good to know that these drugs can be safe if used for a few days or if used for a few years. So the non-steroidal anti-inflammatory drugs would be the preferred medication for arthritis treatment by most veterinarians. There are a number of common prescription non-steroidal anti-inflammatory drugs, or NSAIDs as I'll call them, that are available and that have an FDA approval. And the list is as follows: carprofen, or more commonly known as Rimadyl, meloxicam or Medicam, tepoxylin or Zubrin, daracoxib, which is Daramax, thyrocoxib, which is Previcox, and etodolac, which is Etogesic. These are the modern non-steroidal anti-inflammatory drugs. There are a few others like aspirin that are older and we won't talk about here, but we're talking about the more modern, more specific anti-inflammatories. The way these medications work is by blocking an enzyme in the pathway of inflammation called cyclooxygenase, or COX. COX is the cornerstone of many inflammatory processes, not just arthritis. The COX pathway will produce prostaglandins first and foremost, and these prostaglandins are a very potent inflammatory mediator, which means that they are a very potent part of the whole cycle of inflammation with its associated pain and swelling and lameness. Now, there are some prostaglandins that also play a protective role for the body, and in particular they maintain perfusion or blood flow to the kidneys and to the stomach. And if this blood flow is impaired to either of these vital organs, then you can sometimes run into problems. So we want to preserve the good effects of the prostaglandins, the protective effects of these drugs, without too much interference in their dampening down of the inflammatory response. This has been the focus of a lot of research, and it's been worked out that there are two types of COX. The COX-1, and these play a protective role for the stomach and the kidneys. We want to preserve this, and we want a more specific action against COX-2, which is the pro-inflammatory cyclooxygenase. And the newer anti-inflammatory medications are more selective, usually 1,000 times or more selective for COX-2 than COX-1. So in theory we shouldn't see too many of the side effects, but should be seeing a very good level of anti-inflammatory effect. That's how the theory goes. It's never in biological systems quite as simple as that, unfortunately, but it's a good broad overview of the process. As I said before, there's a recent study that reveals that the non-steroidal drugs can be effective, if not more effective, over a long period of time and with no increase in side effects. They reduce pain. They're not painkillers as such, but they reduce pain through their anti-inflammatory effect, and this also helps dogs to get moving again, and this in turn helps joint nourishment and mobility, and it all spirals upwards if we can get these dogs moving and back to function. So the long-term use is defined as a period of greater than about 21, maybe 28 days. You'll see less cells dying from a process called oxidation. You will also see a reduction in the spinal cord's ability to transmit pain from the arthritic joint to the pain centres of the brain, and this is a very good finding indeed. We used to think that these anti-inflammatories worked purely at the site of inflammation, but we're now seeing that they do in fact affect the transmission of pain through the central pathways of the spine, and this is a wonderful finding. So the NSAIDs can go a long way to improving your dog's mobility. It's not the only thing you need to do, of course. You want to also consider weight control, exercise, joint protection drugs such as the glucosamines, the cosequins, the dasequins. You should talk to your vet about all this, but my advice is that if your dog needs non-steroidal anti-inflammatories, that firstly you try not to use them every day, but if you do need to use them every day, then there is no harm in using them for extended periods of time. My name is Christopher Duran. You can read more on my blog, and you are very welcome to download my ebook, The Dog Arthritis Survival Guide. Thanks for listening.